Discover doctors' tips for managing diabetes in different cultures in this insightful video. Learn about the cultural considerations that impact diabetes management and how to adapt care to meet the needs of diverse populations. Our doctor provides practical advice on understanding dietary habits, lifestyle factors, and traditional practices that can influence diabetes care. Whether you're a healthcare provider or managing diabetes yourself, these insights will help you navigate the cultural aspects of diabetes management effectively. Diabetes is a complex condition that affects millions of people worldwide. It requires careful management and a deep understanding of various factors, including cultural influences. Culture plays a significant role in how individuals perceive their health, approach treatment, and adhere to medical advice. Therefore, understanding and respecting cultural differences is crucial for effective diabetes management. For healthcare providers, cultural competence is essential. It involves being aware of your own cultural biases and understanding the cultural backgrounds of your patients. This awareness can help you communicate more effectively and build trust with your patients. For example, some cultures may have specific dietary restrictions or traditional remedies that they prefer to use. Being open to discussing these preferences and finding ways to incorporate them into the treatment plan can improve patient adherence and outcomes. One of the first steps in navigating cultural aspects effectively is to educate yourself about the cultural backgrounds of your patients. This can involve reading about different cultures, attending cultural competence training, or simply asking your patients about their cultural practices and beliefs. Showing a genuine interest in your patients' cultural backgrounds can help build rapport and make them feel more comfortable discussing their health concerns. Another important aspect of cultural competence is effective communication. Language barriers can be a significant obstacle in healthcare. If your patient speaks a different language, consider using a professional interpreter to ensure clear and accurate communication. Avoid using family members as interpreters, as they may not be familiar with medical terminology and may inadvertently misinterpret information. Additionally, be mindful of nonverbal communication, as gestures and body language can have different meanings in different cultures. It's also important to be aware of cultural attitudes towards healthcare and illness. In some cultures, there may be a stigma associated with certain conditions, including diabetes. Patients may feel ashamed or embarrassed to discuss their diagnosis, which can hinder their ability to manage their condition effectively. Being sensitive to these attitudes and providing a supportive and non-judgmental environment can help patients feel more comfortable seeking care and adhering to their treatment plan. Dietary habits are another critical aspect of diabetes management that can be influenced by culture. Different cultures have different staple foods and dietary practices, which can impact blood sugar levels and overall health. For example, a traditional Asian diet may include a lot of rice, which can affect blood sugar control. Understanding these dietary habits and working with patients to find culturally appropriate alternatives or modifications can help them manage their diabetes more effectively. Physical activity is another area where cultural differences can play a role. Some cultures may have specific forms of exercise or physical activities that are more common or acceptable. Encouraging patients to engage in physical activities that are culturally relevant and enjoyable can help them stay active and manage their diabetes better. In addition to understanding cultural differences, it's also important to recognize the role of social determinants of health. Factors such as socioeconomic status, education, and access to healthcare can all impact a patient's ability to manage their diabetes. For example, patients from lower socioeconomic backgrounds may have limited access to healthy foods or medications. Addressing these barriers and providing resources and support can help improve diabetes management for these patients. Finally, it's important to involve patients in their own care. Empowering patients to take an active role in managing their diabetes can lead to better outcomes. This can involve providing education about the condition, teaching self-management skills, and encouraging patients to set and achieve their own health goals. By involving patients in their care and respecting their cultural preferences, healthcare providers can help them manage their diabetes more effectively. In conclusion, navigating the cultural aspects of diabetes management is essential for providing effective care. By educating yourself about different cultures, communicating effectively, being aware of cultural attitudes towards healthcare, understanding dietary habits, recognizing social determinants of health, and involving patients in their care, you can help your patients manage their diabetes more effectively. Whether you're a healthcare provider or managing diabetes yourself, these insights can help you navigate the cultural aspects of diabetes management effectively. Subscribe for more expert health tips and diabetes management advice.